So our last speaker for today is Allana Cameron, who's been driving the slides. So thanks, Allana. Allana will be presenting on the patient summaries progress. Allana is a senior product manager at Canada Health Infoway, who plays a leading role in the advancement of the Pan-Canadian interoperability specifications. Allana's background is in business analysis, product and account management, and project management. I love this. She's also an avid triathlete and runner, and believes that success comes through planning, dedication, preparation, and perseverance, which are skills that resonate in both her career and personal passions. Allana is accountable for the Pan-Canadian Patient Summary Specification Roadmap, which she will be talking about today. She is the Patient Summary Working Group Chair, Infoway's representative at the Global Digital Health Partnership and Global Digital Health Certification Network Group bi-weekly meetings. And today we're very lucky to have Allana here to present an update on the Pan-Canadian Patient Summaries project. So thank you very much, Allana. Over to you.
Thank you very much. Let me just share my screen. Okay, thank you so much for welcoming all of us from Infoway today. And I get the pleasure to kind of roll up what you've heard so far from my colleagues to really show you how the standards, the terminology, all of the shared Pan-Canadian interoperability roadmap work that we've been doing across the country really start to serve the people of Canada. So people like me, people like you, all of the clinicians that are out there hoping to have more information about the patients that they're seeing. And so what I'm hoping to share with you today is the progress that we're making on the Pan-Canadian Patient Summary and how it's making a difference and where we're at in each of the jurisdictions. And I'm hopeful that when you walk away from this session, you'll really feel that the work that you guys are doing and that you're studying and that you're striving to get your careers into, you'll see how it really makes a big impact on everyday people just like us. So let me dive right in. What I'm going to do is really start with just talking about what is a patient summary, who benefits from it, what are some potential use cases. Then we're going to look at what makes up the patient summary itself. And the Pan-Canadian Patient Summary, we call the PSCA, what's inside of it, and what our testing approach is, and then looking at some actual implementations that are happening currently and into the future. So Linda already introduced me, so thank you very much for that. We'll dive right in. Okay, so what is a patient summary? What we know right now is that oftentimes you might end up at a healthcare provider, whether that's a walk-in clinic or at an emergency department, and they don't know anything about you. And so a patient summary will serve as a standardized set of basic clinical information. So I'll just pause on that for a second. It's going to give your healthcare provider at the point of care the most important information about you that they will need to inform their care choices for you. So if you think about that, that might include your current medications that you're taking, any allergies or intolerances that you have, and any key medical issues. So it is a summary. It's not everything about you from your entire life story. We need to keep in mind that it is the essential information that's needed at that point of care. So in the bottom section of this screen, it's just a smaller bit in blue that I just want to call out that this patient summary is not exhaustive, which we just talked about, and it's not specialty. It's not focused on any particular specialty, and it's not condition independent. So that just means that this is a patient summary that should serve you well at any point of care, regardless of that, if that would be maybe with your family doctor, or if you were at a specialist, or maybe you're traveling internationally and you need to share your health information. On the right-hand side of the screen, I've grabbed a snippet of what some of those core data domains are that are included in the International Patient Summary. So this kind of is going to start tying into the question that we had earlier about why would we tie or build on an international standard? So the patient summary itself in Canada is based on the International Patient Summary. And we're going to talk more about that on upcoming slides, but I just wanted to point out why I had an image here that is pulled from International Patient Summary. So you're going to see this flow throughout the upcoming slides. And as we've talked about earlier, there's lots of links throughout all of the slides that we've been looking at today. So you'll see the first one here in this set of slides that does point you to the International Patient Summary. So you'll get to read about that afterwards if you'd like. Okay, so the patient summary really supports 3 core areas of care. That could be unexpected or unscheduled care. So if you think about you might end up in an emergency room, or you have an issue that you need to contact virtual care online. Many provinces and territories now have that option for patients, in particular if they don't have a primary care provider. Transitions of care is another example. So where a patient may be transitioning from one healthcare institution to another, or transitioning into a long-term care home, for example. And coordination of care is another key area where a patient summary can be supportive, where you may have several healthcare practitioners who are working together to provide you care, and they're all able to see the latest information about you. So really providing that continuity of care across borders. So if you were to go and look up the International Patient Summary, the definition is going to talk a whole lot about traveling across international borders. But the definition is more than that. It's broader, and it's very important for us in Canada to recognize that, because we're a very big country, and we want to make sure that the patient summary is relevant in all cases, whether that be using your patient summary even locally within your own community, from going from point of care to another point of care. Could be across organizations, across provincial borders, could be across national borders and international, or within Canada, sorry. So within nationally, maybe you're traveling for work from one province or territory to another, and then international borders. So even on this call, we've got people from all over the world. So how great would it be if you were traveling from where I'm at in Halifax, Nova Scotia, out to BC, for example, and I needed to go to receive some care, and I could easily show my healthcare information at that point of care. So we have talked about some benefits, and I'm not going to go through everything on this slide because there's a lot of words here, but I just want to call out some key points, and we'll start with patients on the left-hand side. So looking at improving the patient experience, if you think about yourself, or maybe you have elderly family members or children who have chronic conditions, for example, and you're having to repeat their medical history every time that you go to a healthcare provider, this is really helping the patient to be able to take that information in an electronic format and not have to be trying to remember everything. Or if you think about somebody who maybe is on a lot of medications and they're having to take in a bag of pill bottles, this will help prevent that case from happening. So it really also gives patients autonomy over their healthcare to be able to see and remember what all of the information about them is contained. I'm just going to look in the chat here because I see it lit up. Again, this is my personal interest. Has there been any interest in plans to extend patient summary into the paramedicine workflow? So on an upcoming slide, we will basically just mention that. And so we'll talk about that a little bit later, if that's okay. And I will dive into the use cases at that time. But I will mention it has come up. So, okay, let's jump to the right-hand side of the screen and just talk about clinicians, because obviously on this, we're looking at patients and clinicians first, and then of course, all of the other areas that will benefit. But for clinicians, for sure, having an improved efficiency in the information that they're sharing. We're calling out that it could reduce administrative burden. We want to be careful about saying that. And the reason why is we know that administrative burden is a really big challenge today for all healthcare providers. We are not in any way insinuating that the patient summary will solve their administrative burden issues. But if we can cut down even a little bit on the time that it takes them to have to go look up information or to collect information about their patients, that's what we're referring to here. So really just improving that efficiency of care and helping the clinicians have the information that they need to be able to make the proper decisions. When you think about vendors and jurisdictions and healthcare funders for that matter, really having a national standard and that's based on an international standard helps in many ways. Nobody's having to reinvent the wheel. If you are familiar with vendors that are working in multiple jurisdictions, oftentimes today, because there are no national standards, vendors are having to redo their products, redo development and say, if Nova Scotia, then do this. If British Columbia, then do this. If Ontario, then do this. And so we really want to try to avoid that. And so even though there's no legislation in Canada that says that everyone is going to have to use these standards, we're really getting a lot of buy-in today. And that's coming also through the market guidance document that Samantha just presented. In terms of the jurisdictions and the vendors and healthcare funders seeing the benefits in reducing the costs, reducing the time to implement, and being able to then move for vendors, for example, move across borders within Canada and even across borders internationally with their products. So as we start discussing the patient summary in each jurisdiction in Canada, there's key questions that help the jurisdictions decide if the patient summary will make sense in their jurisdiction. Why would they want it? Who would actually contribute to it? What data do they have available in their jurisdiction that could be included in the patient summary and how? So these are, key things that a jurisdiction really needs to think about. And it may seem to us, well, as a patient, of course I want my own patient summary. Why wouldn't a jurisdiction want to implement that? But when they look at all of the sort of, maybe they have a patient portal or other tools that they have within their jurisdiction, they have to really take a step back and think about how does this fit into what we already offer today. And so as we walk through this, implementations might look a little bit different and choices might be made based on the information that they already have available in their electronic health records, for instance. So if we look at the why, what are the key challenges? What are the use cases within a particular jurisdiction? Is the jurisdiction struggling the most with having a lack of family doctors per patient within the province? So we call those unattached patients. Or maybe it's a jurisdiction who has a lot of cross-border care, like territories who are sending a lot of their patients for care to southern provinces. So they may look at different aspects or use cases that they want to use the patient summary for. Who will contribute to and access the patient summary? So is the patient summary going to be the responsibility of a primary care physician to create? Or is the patient summary going to be created from data sources that are already contained within an electronic health record within the province, and then a patient summary is automatically created on demand? So we'll talk a little bit about that coming up as well. Or is a patient summary created when a patient says they want it to be created? So these are all things that we have to think about and talk to the jurisdictions about. Another really big question is what data will be included in the patient summary? So this is really important when you think about the implementation choices and who is going to be creating that patient summary. Where's the data going to come from? And in some jurisdictions, they already have central data repositories that have a lot of information being contributed by multiple sources. So for example, maybe a jurisdiction has an immunization registry and a drug data registry, and they have EMRs who are contributing information into their central data repository. Then all of that information is available to populate a patient summary. And then the last one being how will that patient summary be accessed? So looking at really what tools are available, do new tools have to be developed, and how will that patient summary be consumed and where will it be displayed? Let me just check the chat again for a second. No dumb questions, I promise. Go ahead, Debbie.
It's actually a server question. Do you have to have a server in order to run interoperability standards?
I'm going to say that there's multiple different types of implementations. And so I'm not a really technical person, but when I get to the point where we talk about what the implementation patterns are, I think that might help answer your question. And if it doesn't, either I'm not sure if any of my colleagues who are on the call might want to jump in, or
Hi, when you get to Allana, I can speak to it, but
sure.
You don't need it, but it definitely helps it, and because you can host on the server, you can host all the FHIE requirements for the international patient summary, and that makes it so much easier. I like the idea because we've never had this at InfoWay, and I think that's been sort of a stumbling block where people haven't been able to seamlessly in a FHIE specification pull that information without some middle engagement. Okay, thank you.
Thank you.
Thanks, Anil. So there's a perfect example of I don't know everything, and I'm always learning more. There's always so much to learn, but hopefully I can share enough about patient summary that will help you understand what it is that we're implementing. Okay, so I'm not going to go. I don't have slides that show all the specific, the why, who, what, how, but I did want to just show the why, because I think this one really starts to give you that picture of what the jurisdictions are thinking about in terms of how the patient summary is going to be useful for them. So if you think about a patient and the essential healthcare information about a patient and what kinds of patients it may help. So it could be patients who are requiring chronic care. We talked a little bit about that, or patients who are crossing borders. I use the example here of New Brunswick and Nova Scotia. And the reason why is the last session we had on this particular slide was with them. And I'm going to give some exciting updates about New Brunswick and their implementation in an upcoming slide. So for those providers who don't have, or for those patients who don't have access to a primary care provider, our unattached patients, super helpful for them to be able to have that and show their information, or for those healthcare providers to access. So again, depending on who is able to access and request that patient summary, patients in the midst of transitions of care, collaboration between care environments. And one we haven't talked about yet is there has been discussions in some jurisdictions about pharmacists having the ability to view a patient summary. We know pharmacists have access to lots of health information about you, but they may not have access to everything. So for example, your lab information could be useful for them and viewable through your patient summary. And the last bullet just basically touches on the ability for first responders to be able to have access to a patient summary. I will say we don't have any jurisdictions right now who are in the midst of talking about first responders being the ones to access and create a patient summary. However, in the New Brunswick announcement that I'll talk about coming up soon, it would be more of from the perspective of the patient being able to, if they have the capacity to share their patient summary with a first responder. So it would be useful in that from that perspective. Okay, so we're going to change gears for a moment here and talk about the structure of the patient summary, the contents, and testing. I'm not going to spend a whole lot of time on this slide because I feel like Anil and Linda already talked a lot about standards, but it really just gives you that view of where the standards start to tie into an implementation within a Pan-Canadian specification. So the PSCA, as I have in the top, is based on international specifications and standards. And this is very important because we don't want to reinvent the wheel, for one. Two, there's a lot of great work that's happening around the world that we're actually participating in on bi-weekly meetings. And I know that in my introduction, Linda mentioned that I'm part of the Global Digital Health Partnership and a couple of other groups where we talk about the challenges of the patient summary. We hear about use cases and in different countries and how those start to impact the international standards, which then makes it better for everyone. So we're not having to only learn on our own, we're learning together as one big community. And as we have moved forward with our implementation of the patient summary in Canada, we have been able to provide many inputs into the international patient summary that other countries will also benefit from. So that's a really important aspect for us, is to stay closely tied to international communities and to stay completely aligned with the international patient summary as much as possible. So we are building the patient summary, which is defined in the IHE International Patient Summary Specifications. And Anil talked a little bit about IHE earlier. So you'll see a bit more and some links about that if you were to later look in the deck further back at his slides. And it stands for the Integrated Healthcare Enterprise. And it really talks about the ability to exchange the information between systems. And it also just really talks about how the international patient summary can be used. So when you think about who's creating it, who's the content creator of a patient summary, and who is actually going to be receiving and processing that patient summary. So their concepts are quite broad. And then from a national perspective, we start to build on that to say, okay, in Canada, a content creator might be a physician using an electronic medical record. So we start to layer onto that international standard with what the systems and assets that we have within Canada, so that it makes more sense for a jurisdiction and that they know how to use the standards. So the HL7 IPS implementation guide is also part of the work that we tie into, which represents the information that defines the FHIR standards. And the other two standards we have listed here, one is the CEN EN 17269. It's listed, but really it's been subsumed into the ISO 27269. And what that is the data model that defines all of the content that is inside the patient summary. So the HL7 IPS implementation guide represents the FHIR profiles with that all of the ISO 27269 defines as data content. In the bottom portion of the screen, what we see is that the PSCA FHIR profile set closely aligned with the HL7 IPS specification as possible. But the reason why I say as possible is because we know that Canada has, and even within jurisdictions, there's different legislation and policy that apply. And so we need to be able to be flexible enough to support these localized needs. And we want to be able to reduce the barriers that might be in place to ensure that adoption is possible within Canada. So we'll talk a little bit more on that on this next slide. So we have a big chart here, and I'm just going to walk through it so that you kind of have an understanding of what we started with and where we're at now with the building of the patient summary. So on the left-hand side, what you see is that IPS UV, which is the universal version of the International Patient Summary. And then down underneath that are all of the data domains that are part of the IPS. I will just make a little side note now that, as you know, with all standards, things are evolving all of the time. So when we adopted the IPS and have started working on the patient summary, these are the data domains that are included. We already know that there's new ones being discussed, and we'll stay in alignment with that. So if you do happen to see a document that talks about some additional data domains, you'll know why they're not here. I just want to point out that you're going to see that the IPS defines a header. They define required, recommended, and optional data domains. In Canada, we've adopted and adapted, I should say, all of the data domains that are in the IPS. However, here's one of the differences that we decided that we would like to make sure that in Canada, we're not limiting who can adopt the PSCA by ensuring that we don't say that any particular data domains are actually required. And that may sound kind of funny. Well, wouldn't you want the patient summary to include the medication summary, allergies, intolerances, and problem list? Yes, or maybe not. Maybe the patient summary and initial rollout is going to only be able to include a very limited subset or different subset of information. And we're already seeing that happen in one jurisdiction based on the information that they have available in their electronic health record. So I think we've seen that decision come to be very fruitful for Canada already. But it did not break the standard, I'll just call that out, with the IPS, because we're still supporting those data domains. Across the middle section, what you see are the jurisdictions that stepped forward to say that they wanted to be early participants in the development of the patient summary. So it's a very collaborative process. And we had Alberta, BC, Manitoba, Newfoundland, Ontario, and Saskatchewan all at the table every 2 weeks for almost 3 years, working through everything from the standards that should be supported, the use cases that we should start with, to come out with what should the first release of the patient summary look like. The gray boxes underneath represent where each jurisdiction could see themselves in terms of the data domains and what they think that they could support within their jurisdictions. It doesn't mean that that's where they would be limited to on in the future. So for example, we're currently talking to Ontario about plan of care. And so that's not lit up in this diagram right now, but it sounds like it's an area where they're actually starting to look at wanting to incorporate. And I know that the docs in BC are currently asking questions about advanced directives, and also is not yet included in the patient summary. So we're having discussions about that and being able to include it. So on the right-hand side, you'll see 3 releases that 2 of them have already been published. So the version 1.0.0 trial implementation was our first release that went to a projectathon. So thinking back to Samantha's presentation and the talking about vendor conformance and attending the projectathon, what we had was an event, and I do have a slide coming up about this, so I won't talk too much about it yet, but we had an event where the vendors were able to come together, test this version of the patient summary, so they're able to make sure that the patient summary was created and that they could share it between each other. Right now, we just had a release come out, which is version 1.1.0 draft, and it added on, so you'll see that we included the diagnostic results data domain. And then the version 2.0.0 is currently underway, where we plan to have all of the data domains that are in the IPS included into the PSCA, and any additions that have been changed along the way, which is what the little plus sign represents. So I think the biggest takeaway from this slide is really the collaborative effort that we've had across the country to be able to come together and decide on how the PSCA should be formed and what the roadmap going forward should look like. On the next slide, this actually also ties into the importance of the work that we do on an international scale. So thankfully, we didn't have to start our journey on the patient summary development from scratch. We did, as I mentioned, we started about 3 years ago, but we were able to leverage the IHE international processes as our guide. And so really that really brought together our clinicians, jurisdictions, our vendors, and our developers to go through this process from end to end. So we look at the 4 core steps. The first being really bringing together our clinical and technical and jurisdictional experts, defining out what the use cases should be, what the business requirements are to solve for those the problems that we're seeing in jurisdictions. So like, for an example, unattached patients, and how do we solve for that? What should that use case look like? And then sharing all of that content that's been developed with the technical experts that then start to create detailed specifications for the patient summaries, patient summary to be addressed. And really looking at optimizing those standards and leveraging as much from international communities as possible. And then moving to the third, where we hand over all of the developed content to vendors. So the industry takes that and then they implement those specifications into their systems. And then they're able to come into a testing event like a projectathon and be able to test their systems to make sure that everything's been implemented properly, and that no matter if they're 2 different vendors with different systems, those systems will be able to talk to each other and the information will be understood when it's received by the other system. So what does this look like? On the next slide, this gives you little snippets from the actual specifications. So the first one being content that's been created and developed by the clinical and business teams, which are the use cases and building out the specifications, defining what the standards are that are used, and then handing that over to our technical teams that define out the exchange patterns. So earlier I mentioned who are the actors within the exchange of a patient summary. Is it an EMR system? Is it a hospital system? And what are the standards that need to be, and exchange patterns that need to be shared? So as you can see, this diagram gives you a view, and it dives into some sequence patterns. And then in the third step, where we have reference implementation materials, we really support the vendors with testing tools that they can use while they're doing the development in their own systems, so that they're not coming to a conformance event without previously being able to understand and have tested their own systems against some good testing tools. And then at conformance, that's where they come together and really test against each other instead of just within their own system. So we'll move on to actually talking a little bit more about what that projectathon looks like. So we've had 2 projectathons to date. The last one was in March of 2023. And I'll just point out firstly in the bottom right corner, if you later want to go take a look at the projectathon final report, it will give you a whole summary of what is a projectathon, what happened at this projectathon, what the results were, and so on. Whereas this slide is just really a summary. So we did have 9 vendors who were able to come together and complete over 200 tests. And this is a really big deal for Canada because we haven't had this type of testing event before. But again, we were able to learn from international communities where they come together frequently for testing events like this, also known as connectathons, where they're much bigger and test over a broad set of areas, whereas ours was focused specifically on the Pan-Canadian patient summary. So it was a really exciting event for us to be able to see the patient summary come to life. And what we did was really focused on testing the security and authorization components, the transport of the patient summary, and the contents of the patient summary. So it was the exchange developed properly between, and did it successfully work between systems? And was the content structured properly, and was it interpreted properly on the other end? So those were the key components that we looked at the projectathon. So let's talk a little bit about what's happening right now in Canada. This slide gives just a really high overview, and then I'll dive into some specifics. But basically, we have BC, Alberta, Ontario, and New Brunswick, who are working on their patient summary implementations to go live within the next several months. And so in I will say Saskatchewan and Manitoba, you'll see sort of light colored gray stars there. I do want to call them out because they've played key roles in the development of the Pan-Canadian Patient Summary. However, they already had what I'll call, and in air quotes, patient summary-like implementations prior to the work that we started from a Pan-Canadian perspective. So they were able to feed in a lot of lessons learned, and they're still providing really helpful information for the jurisdictions who are on their journey now. And both Saskatchewan and Manitoba do want to align to the Pan-Canadian Patient Summary and have that on their roadmaps. So let's talk a little bit about what's happening from a limited production rollout or minimum viable product snapshot. So when we think about creating a patient summary, we know that each jurisdiction has different tools that are available. And so if you think about a jurisdiction, let's use Alberta as an example. In Alberta, they've decided that their primary care physicians are going to be the first the first healthcare providers to create a patient summary. So they're actually putting the creation of the patient summary in the hands of a healthcare provider. And so that means that at the point of care, or maybe at a different time, if a healthcare provider is wanting to have a patient summary prepared for their patient, they may create a patient summary in their EMR using data from within their EMR. So this is one implementation, and I just want to point that out because there's some differences here that I want to make clear. So this first bullet, where the healthcare provider is creating a patient summary with content from within their own EMR, and then sharing that real time into their electronic health record. So they're putting it out there into a location where other healthcare providers can then access that patient summary as long as they have the appropriate permissions to do so. So that's one implementation pattern that we're seeing happen right now. The second one that I have listed here is where the patient summary is generated automatically on a daily basis and submitted via a scheduled batch process. So in Ontario, they've been thinking about how can we have patient summaries created for all of the patients within, say, a primary care clinic, but they don't want the healthcare provider to be creating or triggering the process to create that patient summary. They've decided that there'll be an initial configuration within each clinic. A provider will have the option to configure if they would like to have a patient summary created for all of their patients, or maybe a subset of their patients. And then a process would run automatically daily and submit that information, again, into a central repository where other healthcare providers will be able to access that information. So far, you're hearing me talk a lot about healthcare providers creating and submitting that information with information from within their EMR. We have, and I apologize that not all of what I'm about to tell you is on this slide, because we've literally just started to leap ahead into some new use cases this week. So I didn't want to make changes to this because it had already been submitted to you guys. But there is a scenario where, again, it is a primary care provider who's creating the patient summary. However, it's with data from multiple data sources, and it's created at a point where we're calling on demand. So a patient maybe goes to their healthcare provider and they say, oh, you know what? You really need to go to the emergency department right now. And so they want to be able to inform the emergency department about this patient and give them information. So when the patient arrives, there's information about them there. So the healthcare provider, through their EMR, will be able to trigger a process that creates a patient summary on demand from multiple data sources. So not only from their EMR, but they may pull from an immunization registry, the drug registry, and so on to generate the latest information about their patient. And they're going to be able to send it off to another organization like an ER department. I'm going to pause for a question. May I know how the patient summary manage sensitive diagnosis? For example, will these information be shared with the vendor or filed to central repository? So the information stored within an EMR system is never part of what a vendor has access to. So what patient summary information is collected is not different than what a healthcare provider is already collecting. One part that is different in some jurisdictions is that information from an EMR may be shared into a central data repository that has its own security and authorization built in. So only other authorized healthcare providers would be able to access that information. There is an additional layer onto that. And I know we're not getting into all of the details, but I'll just say, in the cases where we're seeing a healthcare provider being able to create that patient summary. So let's use the example that I just gave of a healthcare provider who wants to send their patient over to the emergency department and have a patient summary there before their patient gets there. They're actually going to have the ability to curate that patient summary. So let's say they on demand request the information that gets pulled into the patient summary. It's going to be displayed to them, and they're going to be able to say, yep, I want this, I want this, I want this, and no, I don't want to share that. So if there is a piece of sensitive information that the primary care doctor has been privy to that they know their patient wouldn't want to share externally or isn't relevant to the issue that the patient is going to the emergency department for, they'll be able to ensure that that's not shared. Does that answer your question, Ken? I'll keep going, and if you want to add to that in the chat, I'll check back there in a second. I want to give you, let's see. Yes, okay, perfect. So the latest and greatest news that came out today, and we're all really excited about it, is the patient getting the patient summary into the hands of the patient. And what we're seeing is that New Brunswick is actually working now on a use case that is very prominent in other countries, and it is called the patient-mediated access and exchange of their own patient summary. So I'm going to give you an example of this on the next slide, but I wanted to talk about it here because it is actually now part of our initial snapshot, and I'll be updating this slide in the next iteration. So it's an exciting one, and I'll give you the details of how that works on the next slide in the example. So the implementation patterns, I'm kind of just moving down to that second line now, include EMRs sending information to a central repository or an EMR sending directly as a point-to-point exchange into from their system to a hospital information system. And now what we're going to see in addition to that is a patient being able to have access to their patient summary and share it at the point of care when they choose to do so. At every single one of these implementations, every jurisdiction includes clinical engagement, and then we also have clinical engagement at the national level. So all along the way, we're making sure that clinicians are informing the workflows and helping us to understand what the potential areas that could prevent adoption are. And so that's a core component to our work right from the start to forever. I would say it's not, as long as we're working on the patient summary, the clinicians will be providing input into that. And then, of course, all of the PTs have been working closely with InfoWay, and they adopt what the patient summary work has been done and then make any sort of configurations in their local implementations to meet their own jurisdictional policies or to identify what regional assets the vendors may have to connect to within their jurisdictions. Before I move to the next slide, I'll just check the, oh, okay. No other questions right now. Or maybe, okay. Are SOAP messages and consultation notes part of the patient summary, or are they separate? Consultation notes, there's notes sections, but I would say it's not specifically called consultation notes. And at the end, I'll give you a link if you're interested in diving in specifically to all of the data domains that are that dive into even further detail of the data elements that are in the patient summary. I'd be happy to give you that link so you can go look. And I think you'd find it, I think everyone on the call would probably find it really interesting too, because I think you guys are all a little bit more into the weeds maybe than even I would be in terms of wanting to see the data domains, the data elements, and what the terminology bindings are to each data element. So at the end, I'm going to show you a link where you can go look at all of that. Anil, though, do you have any other comment on this question? I'm just going to put you on the spot.
No, I don't know. I mean, SOAP
Okay.
notes are, subjective, objective assessment and plan. They're a way of documenting information in a patient's chart. But yeah, I don't know that.
Okay.
Okay.
Thanks. All right. Let's go to this slide. Okay, so this slide is really the intent here was saying looking into the future for patient summary, but half of the slide is now today. So let's talk about the left-hand side of the slide first, which really talks about the patient summary and artificial intelligence. We're seeing, and I'm sure you're seeing, you can't live today without artificial intelligence. It's everywhere. And it's also coming into play with the patient summary. So in November of 2023, we had partnered with a vendor and did a demonstration on the value of patient summary to inform the care delivery and enable better patient experience. And it represented or demonstrated the power of AI in combination with the patient summary. So it's not that AI is really creating the patient summary, but what this did was it showed AI scripting, being able to capture the information in a patient visit with their clinician, and then appropriately put the information in the right places within their EMR and automatically generate the patient summary. There is a demo with that. So this presentation was actually recorded, and I have a link here to this demo. I think you'll find it really interesting. We don't have time today to look at it during the presentation, but afterwards, I would encourage you to go check that out, because I think this use case where we're combining patient summary with AI is going to come to life pretty soon. And I know there's 2 jurisdictions, I won't name them, but there's 2 jurisdictions who are currently doing evaluation on patient summary combined with AI. To the right-hand side, though, you'll see a QR code, and you can actually scan that and get a proof of concept of the patient summary work that's being done in New Brunswick. So today, New Brunswick gave us the green light that they are in fact going to implement the patient-mediated access and exchange use case, where a patient will have the ability with their mobile device using the My Health NB app to request that a patient summary be created and that they are given a QR code, which will then have secure health links, a secure health link to share that patient summary information with other healthcare providers. So sure, they will get the patient summary that they can view on their own mobile device, but the QR code enables them to be able to share that healthcare information or their patient summary information at any point of care right now within New Brunswick. And the healthcare provider will have the ability to scan that QR code And right now we're just in the very early stages, so I apologize, I can't give a ton of details, but the areas we're talking about is that the patient is presented with a consent message that they have to approve. They can assign a password and a timeout period for that QR code. And then when they present the QR code on their mobile device at a healthcare facility, the healthcare provider would be able to scan that QR code and obviously would then have to have the password or PIN to access that healthcare information and be able to see the latest information about the patient at that time. So this is a really exciting use case for many reasons, but the biggest one obviously is that it's the first one where we're seeing the initiatives that Samantha was showing earlier. There were 4, and you saw that patient summary and patient was really supporting providers having the ability to access patient health information. However, now another key or core initiative, patient access to their own healthcare information, is going to be lit up, and the work is getting started immediately on this. So we're really keen on this, and we're not first on this. We don't have to reinvent the wheel here either. So one really exciting thing is that we engage closely with international communities. And as I was mentioning earlier, we have already seen in many countries around the world this particular use case being implemented. And a really interesting one that was implemented this spring was between the Kingdom of Saudi Arabia and Indonesia and Malaysia in support of the pilgrims traveling for Hajj. And they wanted to make sure that all of the pilgrims who are traveling, who are generally of senior age, that if they needed healthcare, the healthcare provider would be able to know about them. So one interesting thing about this and this use case is obviously they're traveling across international borders. And so there's additional layers of security required, and the World Health Organization is involved in playing that secure role and having sort of a library, if you will, of certificates. And so these are things that we're learning from and sitting in meetings on, and closely collaborating with the folks from Malaysia to be able to learn about how did they implement this, what should we be doing here in Canada, and have you tripped up on anything? So really, the world is quite small when you start to work together in biweekly meetings and be able to see that we're all trying to solve the same issues. So my last slide is really, where do we go from here? We want to be able to keep supporting our provinces and territories on the patient summary rollouts. So the provinces that I mentioned who are underway, make sure that those implementations are successful. I'm making sure that this works for clinicians and for patients. And then also help additional jurisdictions come on side and implement patient summary. So we're building both short and long-term roadmaps to make sure that there's alignment between the jurisdictions nationally and internationally. Developing the supporting building blocks that Samantha talked about earlier. So we know that there's a lot of really important building blocks that will support not only this patient summary work, but also e-referral and any other upcoming pan-Canadian specifications. And obviously the one that I've been talking about a lot is the continued partnership with international teams to make sure that we're learning from them and that they can also learn from us on any best practices and lessons learned. So really thank everyone for your time today. I'm going to allow for questions, but I do want to just skip ahead to this slide here and mention that there are lots of great sources online if you're interested in anything that you heard about today. The first one is the latest release of the Pan-Canadian Patient Summary. The second one is the latest release of the e-referral e-consult specification. The underlying exchange patterns for patient summary is called the CAFEX, so Canadian Fire Exchange. The CA Core Plus, this is where the Pan-Canadian Health Data Content Framework that you've been hearing about from HIE starts to come to life in the fire profiles. So you'll see that there's a very early release of that that's also available for viewing. In addition, on InfoCentral that the others have also talked a lot about, I've listed the links for a patient summary working group and e-referral. Both are very active working groups with vendors and jurisdictional representation at them. So I just put, yeah, plus many more. There's many, many more working groups and community groups on there. And the projectathon information that I mentioned earlier, if you're particularly interested in testing events, you can read about that here. And these links are all publicly available, and you'll find even a lot more information on those pages than just this. So I'll stop there.